This is Rowena Quilonio's 8th child. Her husband makes $4 a day and they can never afford to go to a private hospital. But she says she is grateful. In a government hospital like this, at least she can give birth for free.
It's very important. When we don't have the money and you come here, they really accept you right away. You don't have to think about how much it costs.
This is the Philippines' biggest maternity hospital, where around 100 babies are born every day. Here, mothers from the poorest communities have access to maternal services in a country where healthcare is largely unaffordable. But that might soon change under a new government policy. President Benigno Aquino's administration plans to privatize over 100 government hospitals across the country. Private companies will be allowed to come in and bid for partial ownership of these facilities, which may mean that around 70% of these hospitals will soon be privately operated. According to Aquino, this is how healthcare services can be improved, but many see his solution as problematic.
You see hospitals now that are being flooded with patients who can't afford to pay, but they go to public hospitals because they know even if they do pay something, it's still within their means, or at least they can borrow money, they can go into loans to pay for those. So government is not only washing their hands, government is completely reneging on its obligation. It's a total turnaround from its obligation.
The government defends its policy, insisting that this will be properly regulated.
I would assume that based on their financial planning, when they enter the bid, that they have factored in what parameters that make sure that they will marry the social objective of providing public health, as well as on their own, on the private entity, that profit margin that they're looking at.
But assumptions like these do not reassure the general public. Millions of Filipinos die without getting proper medical attention, and those who do will still have to pay around 60% of their medical costs. Many here feel the government's plans will only enrich the private sector, and once again, they say they are left to fend for themselves. Jamela, Alindogan, Jazeera, Manila.